My name's Elaine, and today I'll be going over a summary of my practicum project, the Camden County MPH Health Assessment. Now, before I get into the assessment, I will give you some background information on Camden County. So, next slide here. Camden County is a rural county kind of in central Missouri. Estimated population's 44,000. Which as of 2016, which is about a 19% increase since the 2000 census. Our target population is women aged 18 to 65, and there's about just over 14,000 in that population. As a whole, we are about 97% white, mean household income of just over 55,000 annually, and 16.7% of our population does live below the poverty line, and only 22% aged 25 and older do hold a bachelor's degree or higher. Next slide. We are a lake community. This is where the Lake of the Ozarks is. So we are definitely a tourist-driven economy. A lot of people here are only employed seasonally because they can only find work in the summer. Part of being the lake, we have come to be known as the party place, and sadly that does sometimes involve drug use, and our rates of drug use are higher than a lot of the state. So our opioid overdose death rate is 10.43 per 100,000 population, which is one of the highest rates in the state, only below the St. Louis area. And in 2016 alone, there were 240 drug arrests and 236 DUI arrests. And with a survey sent out to high school students in the area, we found that almost 50% had used alcohol before, over 21% had used prescription drugs that were not theirs, and almost 21% had used marijuana before. Next slide. A little bit more about the health of Camden County. Almost 69% of pregnant women start prenatal care in the first trimester of pregnancy, which is much lower than the state average of 74.5%. And then similarly, over a quarter of Camden County women receive inadequate prenatal care, which can be classified as starting care way too late or just making way too few visits, and that's much higher than the rate of 18.56 for the state as a whole. Our mortality rates among minors is higher than the state as well, especially considering unintentional injuries. For example, with the age range of 15 to 19, our rate of unintentional injury deaths is 48.77 compared to the state rate of 36.62. Next slide. So this brings us back to the maternal and child health program. For counties who participate in this program, we're able to choose a state priority health issue from the given categories and then present a work plan to the state, who will then provide funding for this program. The last time we did this, we chose reducing intentional and unintentional injuries related to motor vehicle safety, suicide, and substance abuse. Some other categories to choose from are related to smoking, obesity, neonatal abstinence program, and prenatal care. Next slide. So when we choose our set priority issue, the state has very strict guidelines of how we go about doing that. First, we must utilize all available resources in data collection. And then after that, we are to meet with community stakeholders and determine what they feel the strengths and weaknesses in the community are. After that, we are to use an organized method to seek input from community members. And then finally, use all the information we gathered plus the background information we researched earlier to come together and draw a final conclusion and choose our priority issue. So we did that. We started by researching through all the state databases, anything pertaining to Camden County we looked into. Then we held 2 stakeholder meetings, engaged their perceptions of the strengths and weaknesses in the area. To those meetings, we invited some doctors, some nurses, health department workers. We even had some school administrators there, and daycare providers, so a wide variety that would be familiar with the maternal and child population here. And then after those stakeholder meetings, we did create and distribute a survey to the community. There was an online version of the survey floating around, and then I also went to doctor's offices and sat in the lobby and passed out surveys for women to fill out, and then I also visited daycares and preschools to have the kids take home and have their moms fill out and bring back, and then we also got to pass out some surveys at some health fairs. So here are our results on the next slide. So first we found diet was definitely the most frequently reported hindrance to health, followed by exercise time and then lack of money and resources. Our most frequently reported household problem, number one by far, was stress, followed by lack of exercise and unhealthy diet, then obesity and inability to pay for health care, then depression and other mental health issues. And then more results, I'll go by category here. Prenatal care, our results were actually very similar to what the state databases said. 66% of our women began prenatal care within the first 8 weeks of pregnancy. 65% of women attended at least 13 prenatal visits during their pregnancy. With mental health, 29.4% of our respondents declared that mental health was very important to be accessible to their family, though by and large currently in the community it's not right now. And then 10.1% stated that their mental health needs were not being met at all. And substance abuse was actually the number one issue that every single one of our stakeholders identified. And they even stated that it is such a large problem, it often causes further problems in the community, and if they could all be fixed if we could just somehow get substance abuse under control. Dental health is next. 17% of our respondents stated they didn't have access to dental care at all, and then this was actually the stakeholders' number 2 top issue in the community was lack of dental care. Obesity was tied for third for the most common household problem, and only 44.7% of women in the area even get regular exercise, and only 33.7% of women in the area eat at least 5 fruits or vegetables daily. Tobacco use, we still have over 15% of our women currently smoking, and very similar rates during pregnancy. Over the last 3 years, 14.7% of pregnant women also smoked during that pregnancy. And over a quarter of the women surveyed did describe tobacco as a problem in their household. Next slide. So we had to consider all the results we found and our background data we had from the databases, and we had to determine what the extent of these problems was and the potential consequences of each problem, and then use all that to decide which priority health issue we wanted to address. So we again chose to reduce intentional and unintentional injuries related to motor vehicle safety, suicide, and substance abuse for multiple reasons. First, we would be able to continue work on our past project, which was a water safety program, which is very relevant in the lake area. And then because it is such a broad category, we will also be able to hopefully work towards the mental health and substance abuse issues, which were so commonly seen in all the information that we collected in this assessment. So at this point, we will begin drawing up plans for these programs and then make a plan of a five-year cycle to present to the state. And then on the next slide are my sources.